Hi, I'm Larry Nespoli with the New Jersey Council of County Colleges. At New Jersey's community colleges, we believe that our students, as well as all citizens, need to be informed about the important issues facing higher education. That's why we're proud to support programming produced by the Caucus Educational Corporation and their partners in public television.
Funding for this edition of One-on-One with Steve Adubato has been provided by the New Jersey Education Association, working for great public schools for every child. Wells Fargo, New Jersey Manufacturers Insurance Group, auto insurance, homeowners insurance, and banking under the principle of stewardship. The law firm of GIBBONS PC, Cohn Resnick, providing accounting, tax, and advisory services for more than 90 years. And by New Jersey Natural Gas, proud to support education in our communities. Promotional support provided by the Star Ledger and NJ.com, Everything Jersey. And by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business.
This is One-on-One.
When you first heard that they were doing Charlie Rose and Gayle King, didn't you go, what?
People like laughing at others, so I don't mind if the other is me.
See, you go right into the character. That's what it is.
I'm bringing families together a half an hour each week. Man, I'm doing something special.
And so I do feel successful.
Welcome to One-on-One. I'm Steve Adubato. We are honored to have one of the leading heart surgeons in the nation. She is Dr. Margarita Camacho. She has performed over 300 heart transplants in the past 30 years, making her one of the leading transplant specialists in the country. Heart disease is the #1 killer of women and is more deadly than all forms of cancer, causing 1 in 3 deaths a year. Dr. Camacho, thank you for joining us.
It's a pleasure, Steve. Thanks for having me.
Let's talk about this. By the way, before and we'll let everyone know your connection to Newark Beth and Barnabas Health when we put up your information, but I'm curious about this. When did you know that you wanted to become a heart surgeon?
That's a good question. Back in medical school, I wasn't sure if I wanted to become a pediatrician or an emergency room physician or a surgeon. But when I did my surgical rotation, I loved it. For me, it was a way to take care of a disease right away. And when I did my cardiac surgery rotation, well, that bug just bit me. And I loved it. It was thrilling, it was challenging. And so I'd say back in medical school, about my last year, I decided cardiac surgery was for me.
You know, a few months back at the New Jersey Performing Arts Center, our partners at NJPAC, there was an event in which you were honored, an annual event that Newark Beth has. And you were honored for your work, your team's work in saving lives. I was listening to some of the people, and I see you there accepting the award that night. And I was listening to some of the people who received hearts that you transplanted into them. And they could barely speak, and they could barely describe their appreciation. What is that like for you to hear them say that you've given them life with this new heart?
Well, first of all, there is no way I could do what I do without the amazing team that supports me. And as I often tell them, when I receive an award like that, it's because they've allowed me to stand on their shoulders.
What does it take? Describe what a team of that transplants a heart is. I mean, describe how unbelievably complicated that is.
It's probably the largest multidisciplinary team that exists. Right down from the nurses in the office that screen the patients, the physicians that get together and decide the patient's appropriate. The number of tests that a potential transplant recipient has to go through is just incredible. It'll often take weeks before all those tests are completed. And those are done by, obviously, all the various departments in the hospital. And then we get together as a team and make the final decision that, yes, based on everything, this patient's appropriate.
Or no.
Or no, right.
How hard is that?
That's very difficult. And you know, for all of these people, pretty much, it's the end of the line. So, and
if they don't get the heart?
Well, there are other alternatives or mechanical heart devices that can be placed. And we have a small device now that's been around for almost 10 years, and it's been put in close to 16,000 people. It's allowed them to have a relatively good quality of life.
But is the human heart that it is usually the best option?
Yes.
So I'm going to go back to that.
So if they are an appropriate candidate, they get listed on the National Registry, which is the United Network Organ Sharing Registry. It's electronic. They're put on the waiting list depending on their status, their medical status. They'll be up on the waiting list or low on the waiting list, whatever, but they're on the waiting list and they wait at home or they wait in the hospital. Once the call comes that we have a donor, well, that's where it works like a symphony.
The other thing I know about you is you have actually gone out to get the heart.
Yes, I do.
You,
yes,
personally, go out and get the heart.
Yes.
Why?
Because I think it's important. I have a way of preserving the heart. I've done it the same way all these years. We've had very good outcomes. And
How do you get these hearts? Someone has said, when I die, I want to give my heart.
It's interesting because if you talk to donor families, many of them feel that the heart is the most important gift of all the organs. And for us, that's such a precious gift because there's a lot of emotion involved with that, with the families. I will never forget years ago when I had to go get a heart from a young college girl. And the father waited for me. And he just wanted to shake my hand and tell me that I had the most beautiful heart that he's ever known. And I have to say that in this field, because I've done this so many years, obviously we're very compassionate and we have a passion for what we do. But it's not often that I get choked up at the site and all. And that just really affected me. I thought that highlights, I think, what it's like for families.
We're looking at clinical pictures. It's interesting of the transplant process. The humanity, the humanism, if you will, as we go back and try to match up that part to the clinical part. You never lose that part, do you?
No, you can't. When you're in the operating room, you're concentrating on the surgery. You have to. You're focused.
Right.
If something goes, not the way you expect it, you have to know how to, make things work right, et cetera. So you have to be truly focused. But at the end of this whole process, you have to understand the gift, the tremendous gift that's been given from a donor to a recipient. And the donor family is very keenly aware of that, and the recipient's family is, so appreciative. This is not just regular coronary bypass surgery or valve surgery. You've given someone truly their life.
Their life.
Right. And so when I see patients after surgery in the intensive care unit, and I congratulate them and I say, you've got such a beautiful heart. Not uncommonly, I get a very big hug, and not uncommonly, they start crying, because it's a very different kind of a gift. Let
me ask you this. I could talk to you about this subject forever because I'm fascinated by all the different, not just clinical sides, but the emotional and human sides of this. Talk to us real quickly about why heart disease is such a powerful killer of women. Why?
Well, women have some other risk factors compared to men. One of them is, for example, postmenopausal. There are hormonal changes that will increase your risk of heart disease. Women are also nurturers. They're busy. They're taking care of families. They have a job while they're doing that. Whatever it is, they don't have time to be sick. And they often present much later than they should. Women also have atypical symptoms, another reason why they present later. They won't necessarily have that classic chest pressure that goes down your left arm. They'll have strange symptoms like pain in the jaw, pain in the teeth, indigestion. And these could all be the symptoms of a big heart attack. So by the time they present to the hospital or to the physician, it's late. And they're more likely to die. Since 1984, that's almost 30 years ago, more women than men started dying from heart disease. And that gap has widened over the last 30 years.
How do we begin to turn this around? Some advice for women as they're watching right now.
Well,
and the men who love them and care about them.
Well, the most important thing is if they have any symptoms of heart disease like jaw pain, pain in the teeth, indigestion, potentially, they need to seek help. If they feel like they're getting tired more often, especially if they get tired when they're doing strenuous activities, more tired than usual, they've got to go seek help. It may be as simple as a stress test or an EKG, but something should be done. Certainly if they have risk factors in the family. Genetic disease is one of the most important risk factors. If they have parents that have had heart disease or siblings, they have to be screened sooner rather than later.
And public awareness through the American Heart Association.
Yes.
The Go Red campaign, 30
That's
seconds
right.
on that.
That's right. The Go Red campaign by the American Heart Association has really increased awareness among women over the last 5 to 10 years. They have Go Red luncheons in February, which is Heart Disease Month for women, all over the country.
They honored actually Micheline.
Right.
Micheline Davis.
Right,
from Barnabas Health. We were there.
Yes.
There was a wonderful event, and
That's
we were
right.
there. Why is that so important for women? By the way, go on the American Heart Association website to tell you all about that.
Yes.
Why is that so important for people to know more about?
Well, because if you raise awareness, the more women will seek help if they have symptoms, or especially encourage family and friends to go seek help if they know they have symptoms.
You love what you do,
I have a passion for it, yes.
despite all the pressure?
Yes. It can, sure, there is a lot of pressure, but after all these years, there's so many ways to mitigate that pressure, and I have a great team. So,
Dr. Margarita Camacho, you honor us by being here and the work that you do every day.
thank you so much, Steve.
Thank you. Stay right there. We'll be right back right after this. Thank you, Doctor.
No, it's my pleasure.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org, or find us on Facebook at facebook.com/Steve Adubato, Ph.D.
Dr. Jill Schennum, Chair of the Department of Sociology, Economics, and Anthropology, County College of Morris. Good to have you with us.
Thank you. It's good to be here.
For those who do not know, anthropology is?
Anthropology is a social science. Traditionally, anthropologists used a method of participant observation, long-term ethnographic fieldwork, to study non-Western cultures. But today, many anthropologists are using that same method to look at communities and groups and cultures within the United States and Western Europe as well.
You actually live in the community, study the community, part of the community. What I'm fascinated by is your research, your doctoral dissertation, Bethlehem Steelworkers, Reshaping the Industrial Working Class. 5 years there?
Yes.
Bethlehem, Pennsylvania, right? Talk to us about this, because you're turning this into a book, right?
Yep, I hope to.
That's what we try to do with our doctoral dissertations, right? But this is important because this not only talks about Bethlehem steelworkers, but it talks about really a reshaping, a transformation of the American economy and the American worker.
For me, it was very important looking at what happened to Bethlehem steelworkers who lost their jobs through this very long process of restructuring of the Bethlehem Steel Company and eventually its bankruptcy, because it's not relevant only for Bethlehem steel workers, but many of the experiences that they went through, I think many middle class and working class Americans are experiencing today. I think there are so many middle and working class Americans who have experienced job loss and periods of unemployment. I think there are so many middle class and working class Americans who've experienced a loss of health benefits or declining health benefits. So many Americans are worried about their retirement and whether they're going to have monies to cover that. So these questions of displacement and insecurity and the kinds of benefits that accompany work are not just questions for Bethlehem steelworkers. They're questions for many, many Americans today. And often we think of those questions as related to the Great Recession, but really these are issues of class transformation that preceded the Great Recession, that contributed to the causes of the Great Recession, and that we're experiencing now, even though we're being told the Great Recession is over and has officially been over for the past 3 years.
Doctor, because you spent time with these people, because you got to know them and potentially care about them, people say, well, why don't they just retrain themselves? You say?
I say that it's very difficult, and many steelworkers have retrained themselves and have gone into other jobs. They've become nurses. They've gone into public sector jobs like teaching. But it's a long process to get that education for retraining. And those jobs aren't necessarily better jobs. They often pay less, they continue to be insecure, and they have other kinds of challenges. So many steel workers tried to hold on to jobs in steel for as long as they could because they knew that those jobs were high wages,
Right.
had good pensions attached to them at one point before the company entered the bankruptcy court, and had good health benefits attached to them.
What impact does that have on their families?
An enormous impact.
Describe it.
Well, often steel workers were the primary breadwinner for their families, even though their wives worked as well. They looked towards pension and health care benefits to cover everyone in the family. Many workers had children in college, and they were paying for college educations. So it was very important to them to do things like transfer to other steel plants and try to hold on to those jobs that would provide the kind of benefits that would allow for them to provide for their
Are
families.
we talking, Doctor, ultimately about potentially losing entire middle class here?
A lot of sociologists and anthropologists are concerned about vanishing or shrinking middle class in the United States. I'm very concerned about that.
So, the rest of us who say, well, we're in the financial sector, we're in the media, we don't work with our hands, that's not our thing. We shouldn't be that worried about that. We're wrong, aren't we?
Well, I think, first of all, the middle class and working class, and I have a very broad definition of the working class,
Right.
which includes a lot of middle class, may not be people who are working with their hands. Many people in white-collar positions are losing their jobs.
That's
Their
right.
jobs are increasingly insecure. They're moving from higher paying jobs, lower paying jobs. I mean, we read in the newspapers all the time about increased inequality within the United States. So for example, just last year, the average pay for CEOs went up about 16% within the United States, even as in the Lehigh Valley, the area that I'm in, median pay for workers in Pennsylvania went up for all workers, went up only 5%. And that's real wages are declining for many of these people because even as their wages are going up slightly, they're paying more for their health care benefits and for many other expenses.
The disparity gets greater. County College of Morris, the program that you lead, the basic goal is graduating students who are able to do what as they move forward?
Many of the students who come to the County College of Morris want to transfer into four-year schools. So they're looking for an affordable education. And this relates very much to my research on steelworkers because we also see tremendously increasing inequality in higher education in the United States. Many talented and qualified students simply cannot afford to go to the upper tier colleges any longer. They can't take on that burden of student loan debt that so many of our young people are graduating from college with. So a community college provides a more affordable option for students to come and do the first 2 years of their education. And the County College of Morris, we get many students who are transferring. We get students who transfer into some of those top tier schools. Because the goal of community colleges is really to provide access to the public, to focus on teaching, not on research. And so as a result, we have things like very small class sizes, faculty have a lot of interaction with students, and we do a lot on campus to try to facilitate faculty teaching. And we have fantastic faculty. In my department, the one that I'm chair of the 8 tenure-track faculty members, 7 have Ph.D.s from prestigious institutions.
Doctor, you tell an important story. The rest of us need to understand it and care, and we appreciate you coming in.
Well, thank you very much for having me.
Thank you, folks. We'll be right back right after this.
If you would like more information on this program, or if you'd like to express an opinion, email us at info@caucusnj.org. Visit us online at oneonone.org or find us on Facebook at facebook.com/Steve Adubato, Ph.D.
Vaughn McKoy is the author of Playing Up, One Man's Rise from Public Housing to Public Service Through Mentorship. Good to see you, Vaughn.
Thank you, Steve. Great to be here.
And a very important book. We have been talking about this for a long time. It took you how long to write this book?
3 years. 3 years. I started in July of 2010, and we released it in June of 2013. So it took me about 3 years to go through the whole process.
Playing Up is a must-read, says Dr. Joe Clark. We know Joe Clark from Lean On Me, right?
Absolutely.
And you got some great people quoted on the back, and I'm proud to be one of them.
Thank you, Steve.
Listen, when we've known each other a long time, by way of background, you should tell folks, academically, you achieved a great deal. You have a law degree.
Yes, I do.
You have a MBA.
That is correct.
You've worked, tell folks what you did with your law degree.
Well, I started out at a firm in Newark, Sills Cummins, back in 1993 after I graduated law school. I worked 2 years there as a law clerk while in law school, and was fortunate enough to land an opportunity there. Worked there for about 5.5 years, and then was privileged to be asked by the U.S. Attorney at that time, Faith Hochberg, to join the U.S. Attorney's Office as an Assistant United States Attorney prosecuting cases in federal court. Did that for about 3.5 years, went back into private practice for about 6 months until Governor McGreevey was elected. Dave Sampson became the Attorney General. Peter Harvey became the first assistant, and I went back into state government this time as the first Deputy Director for the Division of Criminal Justice, eventually to become the Director and run the state's largest prosecutor's office.
And then into the private sector.
And then back into the private sector at PSCG.
Well, see, that's part of the story. But the story starts, we're in Patterson where we do this show.
Absolutely.
Probably not too far from here.
Not too far from here. Actually, I was born right behind us.
St. Joseph's.
At St. Joseph's Hospital on July 30th, 1968, which is 45 years to the day I'm sitting here.
Happy birthday.
Today is my birthday. Thank you, Steve.
This book is about your life, lessons in your life. And by the way, the title in and of itself, Playing Up, is significant. Playing up is a sports term. Describe it.
Yes, well, I guess it started for me when I was 8 years old, playing for the New Jersey Bank Shorties, and I had to play with the 9-year-olds, and they were bigger and better than me, and so I found myself in a situation where I had to quote-unquote play up. And over the course of my life, I've always found myself in situations where I had to either draw on my past experiences or my current situation in order to leverage or solve a problem or create a future opportunity. And so I constantly found myself in the state of playing up to the next level in order to take advantage of opportunities or to solve a problem.
The other big theme in this book is about mentoring. I want to show a shot of you and one of the biggest mentors you talk about in the book, Arthur Goldberg. Huge part of the story. And by the way, get the book called Playing Up. You really want to read as you see a shot of Vaughn and Arthur Goldberg. Describe very quickly the synopsis, the Reader's Digest version of Mr. Goldberg and why he was so important to you.
Well, I met Mr. G.
You were playing ball at Rutgers at the time, right?
I was playing ball at Rutgers. I was on a football scholarship, working out in the weight room. Mentioned to one of the coaches that I wanted to be a lawyer. He said, I know a lawyer who you want to talk to. And I would see Mr. G in the weight room, but I didn't know who he was at the time. I just thought he was a guy working out. And lo and behold, I find out that he's a very successful lawyer who turned into a very successful businessman. And we struck up a conversation one day in the weight room. One thing led to another. He began to advise me on things that I should do, courses I should take. And over the course of a 10, 11-year period, you know, what started out as a mentor-mentee relationship really transformed to that of a father and son.
Why do you think that happened?
Well, I think he saw something in me that I probably didn't see in myself at the time. I mean, he was always a very keen observer of talent and could, you know, size people up very, very quickly. And so he always told me there was just something about me. He thought I was gritty, he thought I was tough, he thought I'd never back down for a challenge. And I thought, according to him, that he believed that there was something that he could invest in me that would help me fulfill my potential. And it was really about, you know, the power of potential through mentorship.
As we show some pictures in the book, and I knew when you were writing the book, we had talked several times, because the process of writing the book is fascinating, right?
Yes.
Of getting it published and getting it out there. Why did you write this book, and what are you hoping to accomplish? Because it's not for you.
It is not for me. I wrote the book, number one, I think as a tribute to him, because I want, you know, young people, you know, to know around the world that there are people out there like him who really care about investing in young people. And when he died about 11 years ago, I would tell the story in different settings, and people would say, look, you got to write the book. You got to really tell the whole story. He was just a great man, and with so many people who contributed to my growth and development, so I don't mean to undermine them in any way, but he entered into my life at such a crucial point in time and opened up doors and opened up my eyes to opportunities that I never really thought of. And so I think it's very important that kids, particularly those growing up in the inner city, know that they can make something of themselves. And also for people like you and me who mentor these kids to know that our mentorship and our mentoring does and can make a difference.
Because you do it today. You do it every day.
Absolutely.
Why do you do it?
One, because I promised Arthur before he died that I would do it. I sat across the table from him one day and he asked me, Vaughn, do you know why I'm doing this for you? And I said, no, I don't, Mr. G. And he said, so that you can turn around and do it for somebody else. You don't owe me anything. You know, you owe it to the people who are coming after you. And so I took that, you know, to heart. And so I'm doing what I do, one, because I love it, but because I understand that there are so many people out there who can be affected, you know, by what I do and influenced by what others do to help them as well.
When you've been out there with this book, I know when you had the opening, it was huge, the book signing. Young, largely African-American and Latino
Yes.
young people, not just them, but mostly in inner cities. What kind of reaction have you gotten?
Very, very positive reaction from, you know, 15-year-old girls to 60-year-old men, you know, and everybody in between, you know, read the book. And so my hope is that, one, it inspires, you know, those kids, but also inspires the people who lead them, because in order to have mentorship, you need a mentor and a mentee. And so I hope both audiences really gravitate toward this book and use it as a tool to learn from some of the things that I went through in life.
And some of those keys to your success, other than really hard work, are?
Well, I mean, number one, being in the right place at the right time. I mean, you know, a lot of it is being in the right place at the right time, and I was very, very fortunate, you know, to be in the right place at the right time. You know, really, really good people, you know, to kind of help me along the way and let me know that they really cared about me and they wanted to invest time and effort in me. You know, my mother, you know, who, you know, was a rock of a woman and did a lot, you know, to raise, you know, 7 kids, me being the youngest, you know, practically on her own. So all of those things, you know, really help to sports. I can't undermine the value of sports and teaching me discipline, and, you know, coaches coming to pick me up, to take me to practice, to keep me out of trouble. So all of those things made a very, very large impact.
You're still playing up, aren't you?
Every day.
It's important.
Absolutely.
Never accept status quo.
Keep moving forward. Keep playing up.
The book is called Playing Up: One Man's Rise from Public Housing in Paterson,
New Jersey, P-Town.
P-Town, to public service through mentorship. Even though I'm from Newark, you could be Jersey City, Camden, Philadelphia, anywhere. New York City, it's a powerful book. My friend, Vaughn McKoy, congratulations.
Thank you, Steve.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One has been provided by the New Jersey Education Association, Wells Fargo, New Jersey Manufacturers Insurance Group, the law firm of Gibbons PC, Cohn Resnick, and by New Jersey Natural Gas. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System. This program has been made possible in part by New Jersey Institute of Technology.